Temporal aneurysms and migraine surgery. Since Guérin's initial report, the surgical approach has proven to be a viable treatment option for patients suffering from drug-resistant migraine. In cases of temporal localization, the most frequently used surgical approach involves neurolysis of the auriculotemporal nerve and the coagulation/ligation of the ectatic superficial temporal artery. Aneurysms of the extracranial carotid artery and its branches are rare, with a reported incidence of 0.2% to 5% of all carotid artery surgeries. There are various causes of these aneurysms. Most common cause is atherosclerosis. Other causes are congenital, trauma, and infections. The preferred method of treatment is surgical. The present study reports 2 cases of chronic migraines associated with aneurysms of the superficial temporal artery. The diagnosis was confirmed by a board-certified neurologist after failure of several attempts of different medical therapies. The patient reported no history of trauma, infection, or any previous surgical intervention. The Migraine Disability Assessment Scale, MIDAS, score was used to evaluate the degree of disability. The pain was typically pulsating and localized in the ipsilateral temporal area. Case 1. The first patient was a 26-year-old woman who suffers from migraine without aura since menarche. Case 2. The second patient was a 68-year-old woman with a 36-year history of migraine headache. In both cases, ultrasound examination was indicative of a pseudoaneurysm. Case 1. Size 3 by 1.2 centimeters. Case 2 2.8 by 1.6 centimeters. Aneurysm ligation was performed under local anesthesia via temporal access of 3 centimeters. No other surgical maneuvers were performed. Both patients made an uneventful postoperative recovery. Over the next 6 months, no further attacks were recorded and the patients were completely migraine-free. Currently, the prevailing theory of migraine's pathogenesis embraces the role of inflammation and neural release of peptides in the development of migraine headache in addition to the vascular theory, and migraine is thus considered to be a neurovascular condition. Several studies have shown that certain parts of the brain play a critical role in the pathophysiology of migraine, including the trigeminovascular system and extracranial vasodilation. In our case, simple ligation of the aneurysm resulted in complete remission of symptoms in both patients. The novelty of this therapeutic approach consisted in achieving healing following the simple ligation of the aneurysmal vessel, without the other procedures, myotomies, neurolysis, currently described in these cases. This is probably due to the resolution of the mechanical microtrauma caused by the pulsations of the ectatic vessel in the adjacent fibers of the auriculotemporal nerve, which acted as a trigger point triggering the attacks. In addition, the direct elimination of nociceptive stimuli caused by the dilation of the vessel walls could have played a role. Recent studies have shown that specific ultrastructural abnormalities characterize the vessel walls of migraine patients. In our opinion, the specific role of these anomalies should be the subject of further dedicated studies. Temporal